Right now on 12 on Health, an at-home fertility test for men. Plus, a new procedure to solve the dangerous heart rhythm problem of afibrillation. And sweet new information for folks who like to eat desserts for breakfast. This is 12 on Health with Gillian Nick.
Hello everyone, thank you for making 12 on Health part of your weekend. We have two top surgeons here today covering common medical issues that can be very serious if not addressed early. One is a heart rhythm problem that can lead to a stroke or congestive heart failure. We'll get to that in just a bit, but first, orthopedic injuries and when you need to get to a doctor. Our guest now, orthopedic surgeon Dr. Sabrina Strickland, has seen patients with various broken bones, torn ligaments, you name it. Dr. Strickland comes to us from the Hospital for Special Surgery Affiliated Physicians Office in Old Greenwich. Thanks for being here.
My pleasure.
So many folks, they feel a pain or an ache and they think, I'll wait it out a few days. When do we need to get to a doctor? What are the warning signs?
So the warning signs are, I would say, number one, if it's a mystery, you don't know what happened. If all of a sudden your calf hurts, your thigh hurts, or something's swollen and you don't remember any type of trauma, you need to get to a doctor. That could be a blood clot, and we need to diagnose those right away.
Oh, okay, that is excellent advice. If you've brought up the example earlier where if you're on the tennis court and you feel like, ooh, I feel like I pulled something, then what?
Well, if you pull something, you might have strained something, you might have sprained something, it could have been a ligament or a muscle injury. You can wait. It's very unlikely that that problem is going to need medical attention in the first place, and if it does, you're going to know. If you're not getting better or if you're actually getting worse, you should see a doctor.
If it starts to swell up, you gave us a quick little guide to go by, and that is rice. So rest, ice it, use some compression, and elevate. Tell us about this.
So basically, when you have an injury, it's like when you have a headache. You can't keep banging your head against the wall. So when you have an injury, you need to rest that extremity. So let's say it's your knee. You need to basically stay off of it. You might be able to ride a bike, but you don't go out running or keep playing tennis. Secondly, as far as ice is very helpful for inflammation, and there's been good and bad press on ice. As long as you don't get frostbite, it's not going to hurt you. And so, ice is very safe and it's very cheap. As far as compression, a simple ACE bandage will help the swelling go down quicker, and that'll help your body concentrate on healing rather than taking away the extra fluid. And elevation, if you can get that extremity above your heart, at least part of the day, it's very helpful.
Now, is it absolutely necessary to ice it before you use?
No. It doesn't have to go in that order.
Oh, okay.
Just
get rid of the inflammation any way you can.
Absolutely.
Where do you stand on using anti-inflammatories, over-the-counter meds?
I think there are some great drugs over the counter. I mean, they're basically what we have by prescription, but as long as you don't have a stomach problem and it's a short course,
okay,
a few days to a week, I think it's very safe.
So if you're taking something like Advil or another ibuprofen drug,
sure,
that would help with the inflammation?
Absolutely. It'll certainly help with the pain, and hopefully that doesn't affect your rest, because you should still rest even if you're not in as much pain anymore.
That's hard for a lot of people to
Absolutely.
do. They're hard to say no to the activities. How long do you say it's okay to be on an ibuprofen product before you really need to stop and get to a doctor?
If you need it beyond about a week, I think that should be an indication that maybe something more serious is going on.
A colleague of mine said she woke up and her hand was killing her. She doesn't recall injuring it. Now, she's only 30 years old. She says, is this arthritis? How do you know?
Well, arthritis typically you don't just wake up with. Arthritis is just typically gradual. It may get worse on a particular day, but you knew something was wrong beforehand. And obviously at 30, you're right, it's very unlikely it's arthritis. But if you wake up with something, it could be as simple as just having slept wrong. If you sleep in a very flexed or extended position, it could put a lot of strain on those ligaments and the tendons in the wrist, and that may be all that's going on.
And at what point do you think this could be carpal tunnel?
Carpal tunnel is numbness and tingling. And it's different than, you can have some pain, but it's more tingling, numbness. You reach into your pocket, you're not sure if it's a quarter or a nickel. So carpal tunnel is a little bit different. And carpal tunnel, a lot of times, is treated with a night splint so that you don't flex your wrist up all night long. People tend to sleep all curled up.
Yes. Okay, that's interesting. I like the differentiation. I never knew that about the tingling. What injuries do you find people ignore too long?
So I think people ignore rotator cuff tears too long. I mean, they don't know their tendon is torn in their shoulder. And of course, how would they know? But if something's really weak, that's not normal.
Okay.
You know, if something's very sore and weak, yeah, you know, and if it's short-lived, that's reasonable. But if something's weak, something more serious is going on.
Don't just live with it like that.
No, because at a certain point it becomes irreparable. So you don't want to wait to that point.
With surgeries like rotator cuff surgery, do you think it's important to hold off till you absolutely need it? I know a lot of people are saying, I think I'm going to need this surgery in a few years.
For rotator cuff, absolutely not. There's a lot of data that the longer you wait, the worse your result's going to be. Meaning you're going to have a less chance that we can actually repair it, less chance that it's going to heal, and any atrophy is irreversible in the rotator cuff.
Oh, so go for it.
For the rotator cuff, go for it.
How long is the recovery on that?
Somewhere between 4 and 12 months, a long time.
But for the first 4 months while you're recovering, you can still use it?
You could type. For 6 weeks, you're in a sling. So for 6 weeks, you're not driving, you're not reaching overhead. After that, you're using it, but not if you're a construction worker or need to lift things.
Right, right. Okay. Wow, that's interesting. I knew it was a tough recovery because I know a few people who need it, and they've said they're going to hold off as long as they can. But interesting that you say don't hold off too long.
No, not for that.
Thank you so much, Dr. Strickland. In just a moment, details on a heart procedure.